Thanks for staying with us. You're watching TVC News at 7. Let's now turn our attention to health matters. The Executive Director of the National Primary Healthcare Development Agency, Dr. Muyi Aino, says the administration of President Bola Tinubu is making significant strides towards strengthening Nigeria's primary healthcare system. Dr. Aino was speaking during the NPHCDA's first quarter press conference in Abuja. He highlighted the government's renewed commitment to improving health services through comprehensive revitalization efforts aimed at increasing the number of functional primary health centers across the country. The NPHCDA also reported a significant rise in service utilization, with more than 20 million patient visits recorded quarterly.
The blueprint really has three pillars. One of them, the pillar one, is to achieve a strengthened NPHCDA that is positioned really for effective and accountable implementation of the primary healthcare system. The second pillar, which is what most directly touches the lives of Nigerians, is to provide efficient and equitable quality primary healthcare services that Nigerians trust through the primary healthcare system. And the third pillar is really to position the primary healthcare system as an effective frontline platform to strengthen health security. President Bola Ahmed Tinubu's renewed hope agenda to touch the lives of Nigerians.
Now, government officials and key players converged on the nation's capital for an interministerial dialogue aimed at addressing critical issues affecting young people. The event brought together representatives from various ministries, including health, education, youth affairs, and social services, to strategize on integrated approaches for supporting adolescent health and well-being. Senior reporter Habida Lawal reports.
The dialogue here is highlighting the urgent need for cohesive policies and programs that address the multifaceted challenges adolescents face, including mental health issues, nutrition, education and access to healthcare services. Participants acknowledge that approximately 1.2 billion adolescents globally are at a crucial stage of development, and the decisions made during this time can have lasting impact on their health and future opportunities.
People are crucial actors, leaders and partners. To this end, UNESCO is committed to support them, accompany them in removing inequality, contributing to sustainable development and building peace.
The federal government has so far disbursed 30 billion for 261,000 students under Nigerian Education Loan Fund program. So far, the scheme has received about 420,000 applications and disbursements are being scaled up.
The need for improved access to health services for adolescents was a central topic. Discussions focused on ensuring that young people receive accurate health education within schools and that healthcare providers are trained to address the unique needs of adolescents.
You know, it's some of the issues, if you come to northern Nigeria, they are so embarrassingly mundane that one will even feel shy of mentioning it, you know. So what we can say to our government is to not fail and let history not remember them, you know, as part of people who have failed for its children, especially in the northern part of Nigeria. I believe they need to prioritize children on the streets. They need to prioritize Almajiri children, you know. Even if it means kind of strengthening the Almajiri system itself, you know, bringing like the Western education part of the system.
The process for us to amplify the voices of adolescents and youths in Nigeria is a process for us to ensure that we get governments to move from just merely signing commitments into implementing those commitments, even when they do this at global and regional levels.
As the dialogue concluded, participants expressed optimism about the collaborative efforts required to improve adolescent health and well-being.